The death of former Texas Roadhouse CEO Kent Taylor is leading to a much bigger conversation about how COVID-19 can impact your mental health. Tonight, Jarrell Baker has more on how COVID can prove a killer in more ways than one.
We all know COVID-19 can deal your body a serious blow, but it can be just as harmful to your mental health.
I'm just going to be honest. I promise you, I wanted to die. I thought I was dying, and I couldn't even pray.
Erica Estes got COVID at the end of January. She was hospitalized, developed blood clots, body aches, stomach pain, and much more. As her symptoms piled up, she started feeling delusional, experiencing a brain fog. The pain was too much, and she wanted to give up.
I kept getting sicker. I didn't think I was coming home.
Local sports agent Patrick Aaron contracted COVID-19 in June while attending training for the New York Giants.
It plays an effect on so many other things, such as depression, my sleep pattern.
Aaron says during quarantine, he experienced normal symptoms like chills, but after somehow testing negative 23 days later, his troubles worsened. For 6 months, he was fighting to keep his voice.
The scariest part was me being in my 20s and not being able to breathe at all. They were giving me steroid shots. They were giving me antibiotics. I was on an inhaler for 2 months.
Last week, Texas Roadhouse CEO Kent Taylor died by suicide. His family saying post-infection symptoms from COVID-19 are to blame. Local experts say the long-haul effects of COVID-19 are real, as is the mental anguish.
People that experience chronic pain frequently also experience anxiety and depression. So there definitely is kind of a mind-body duality.
Estes and Aaron says they only overcame the mental health troubles by leaning on others.
We are fighting for our lives. And if we just happen to look at a text and it say, I love you, we're praying for you, or hearts, or you send something, that will help us.
They encourage those struggling to seek counseling and or make a connection with a place of fellowship like a local church. In Bell County, Jarrell Baker, 25 News.
Of course, the larger pandemic has impacted mental health as well. The CDC conducted a survey over the summer. More than 40% of respondents reporting symptoms of anxiety or depression or increased substance use. More than 10% said they had seriously considered suicide in the past 30 days, compared with just 4% who said the same thing a few years earlier.